We got a great patient in her later 20s. She had implants placed, had a child. She has a capsular contracture here on the left side. You can see the implant position where I've marked is up higher, so the breast is hanging down lower. We're removing implants. We're going to do removal of the capsule here on this left side. And she wants a very high and much perkier shape. So we're going to do a breast lift and get things up higher. So there's an enlarged, larger diameter areolar skin. We're going to reduce that and move the breast up higher. We're going to get it moved up more onto the chest as well. So removing implants, remove the capsule, replace it. If we look from the side, we can see after now, definitely have lifted the breast, have a nice full round shape. It's a little over full to start with. Her original markings here where this was contracted and up higher. Now we have much more evenness and a nice full shape up above. She definitely wants that high rounded shape. Won't need the bra to do that lifting of the breast, especially over here on the left where she had the high implant shape with the breast falling off of it. So very nice lift with replacement of implants.